Well, hello, everybody. Good afternoon or good morning, depending on where you are in the country. My name is Garrett Schmidt, and I'm the managing editor for VBC Exhibit Hall. And I'd like to welcome you all to today's live webinar hosted by Lightbeam Health Solutions. And this one is titled Overcoming Population Health Pitfalls, 5 Proven Strategies for Value-Based Care Orchestration. And I was able to get a little bit of a preview on this. And so I think you will really enjoy the presentation today. A few items of note before we get started. Everyone has joined today in listen-only mode. This is a traditional webinar format, so you don't need to worry about muting your microphone or your camera or anything like that. We can't see or hear you, but as I always say, we do want to hear from you. We are going to have a time for some Q&A towards the end of the session. So at any point, you don't need to wait until then, but if at any point you have a question that you want to ask either of our speakers or just in general, go ahead and drop that into the question module where you actually have, in your little attendee module, you have a place for questions, which is different than the chat. So go ahead and drop your question in there at any point. If we don't get to yours for some reason, don't worry, someone will reach out to you via email afterwards, but we're going to try to get to as many as we can during the allotted time today. And then finally, the session today is being recorded. So what's going to happen is after we're done, you'll receive an email from one of us, maybe about an hour or so after the conclusion. And there'll be a link to the recording as well as to where you can download the slides, and there'll be some more information about how to get in touch with the Lightbeam crew. So without further ado, I wanted to very briefly introduce our speakers today, and they'll give a little bit more of a background on themselves. But we have Ms. Jennifer Newell, and she is the Clinical Transformation Advisor with Lightbeam. We also have Melissa Tyler, and she's the Director of Advisory Services. So I believe, Melissa, you're going to get us kicked off, so welcome.
Yes, I am. Thank you, Garrett. So as Garrett mentioned, my name is Melissa Tyler, and I am the Director of Advisory Services here at Lightbeam Health Solutions. I've been here a little over 4 years, and I currently oversee the population health and the clinical transformation teams. So just a little bit about my background. So for the past decade or so, I've been working in the value-based care and the population health sector with payers, pub health vendors, along with healthcare technology companies. And I will hand it over to Jennifer for a brief introduction.
Great. Thanks, Melissa. And thank you, Garrett, for kicking us off. I'm really excited to be here with all of you today, but just a little bit about myself before we get started. So my name is Jennifer Newell, and I am, as Garrett mentioned, a clinical transformation advisor here at Lightbeam. I have been with Lightbeam for the past 2 years, but I'm a nurse by trade with over 19 years experience in various roles and settings, with the past 11 being in clinical advisory focused roles, really supporting clients, right, with the development of their clinical programs and really implementation of their care management efforts. So now I'm going to turn it back to Melissa to really get us kicked off.
Okay, so let's run through a very brief agenda here. So we're going to go through some industry trends. Then we will go through a little bit about Lightbeam Health Solutions, along with what role advisory services plays within our client base. Then we'll get into the exciting stuff. So jumping into the 5 population health pitfalls, along with strategies to overcome each of these. And after we conclude, we will have a brief Q&A. So everybody will have the ability to ask any questions that they come across during the webinar. Next. All right, industry trends and the evolution of value-based programs. So the basic premise is really to organize our healthcare system in a way that compensates the provider for the quality of care delivered. And in an effort to achieve this goal, we've seen Medicare experiment with a number of value-based care programs. And most recently, we've seen the announcement of the ACO Primary Care Flex model that actually begins in January of 2025. And this model really aims to grow participation in ACOs through MSSP or the Medicare Shared Savings Program, thus increasing the number of people in a value-based care arrangement, which ties to CMS's goal of having all beneficiaries in a value-based care model by 2030. And in the past year, we've also seen a steady increase of enrollment in Medicare Advantage or Part C plans, with Medicare Advantage growing by 2.2 million enrollees. And we don't foresee any signs of this slowing down here. As the CBO, they projected Medicare enrollment to reside at 62% in 2033. So we also continue to see an increase in value-based care models, both in the Medicaid and the commercial sectors. So as of today, capitated managed care is the dominant way in which states deliver services to their Medicaid enrollees. So although the value-based care models have their differences, so different age groups, different reimbursement methodologies, risk exposure, right? They all have the same core goal, which is really to manage cost, utilization, quality, improve patient outcomes as these organizations continue to progress through that risk continuum. And then next, please.
So now that we know a bit about the evolution of value-based care, right? What can we really do to kind of ensure success? Studies show that, or have shown that each year, 1 in 5 rising risk patients really become your expensive high-risk patients. That's why it's really important for you to look towards a proactive management approach aimed at impacting your entire population. Because continuing to care manage only focused on high risk will not really bend that cost curve that we're looking for. It's important to really note too that your rising risk population often accounts for a really sizable portion of your population, providing you with such a great opportunity to avoid those future costs and really stop your high risk population from continuing to grow. These patients are often not on any radar and move in and out of being stable. They may have 1 or more chronic conditions, moderate utilization, fluctuating symptoms, and really additional risk factors, increasing their likelihood of becoming more costly over time. So focusing a strategy on the whole population helps you to ensure that you're preserving the health of your patients, not only giving you that greater clinical impact that we're looking for, but really that important financial one as well, right? So now I'm going to turn it back over to Melissa again to really provide you with a quick introduction into who Lightbeam is. Next.
All right, so a little bit about Lightbeam Health Solutions. So Lightbeam is a population health enablement platform that provides a holistic view of patient health in order to really improve clinical outcomes and also elevate the quality of care that is being delivered. So from a data collection standpoint, we have the ability to ingest and organize data from several different sources, whether this be claims, clinical, SDOH, HIE, in order to get an overall view of our clients' patient populations, their affiliated risk, also gauge performance and identify opportunities, and also to track and demonstrate outcomes, whether these be financial or clinical. Both are equally as important, as Jen mentioned. And you really need all of these data points to make data-driven decisions specific to your population in order to succeed in your value-based care arrangements and ensure that the proper care is being delivered to each individual patient. So Lightbeam also plays a key role in automating and operationalizing your workflow. So we work with several clients who, prior to Lightbeam, were manually disseminating those patient level, I call them action lists, if you will, from a variety of different sources. And as we know, this is tedious, it's manual work, and having the ability to automate workflows really is crucial. And it also allows our medical professionals to focus on patient care. So along with the core platform, Lightbeam has an integrated AI tool that identifies those social vulnerabilities paired with recommendations. So the what is it, but also how do we solve for it? We also have deviceless RPM along with staffing options via our Lightbeam Clinical Services team. So during and post-COVID, several of our clients were forced to lay off their care management teams, their pop health teams, and LCS really aided in closing that gap there. So from a solution standpoint, we're all working towards the same goal here, right? which is to have a single integrated solution to monitor, care for, and mitigate risk within our patient populations. Next, please. And now we will hop into advisory services. So advisory has two branches that really complement one another. So we have the population health advisory team along with the clinical transformation advisory team. So I'll speak to the pop health. So from a pop health standpoint, you probably guessed it, we have a heavy focus on population health. And we collaborate with our clients to solidify their population health strategies and ensuring that these also align with their contractual obligations. So we utilize the data sources that we discussed previously to baseline performance, track and trend initiatives, along with identifying any additional opportunities that lie within their patient populations. So we also play a key role in operationalizing workflows within the Lightbeam platform to ensure it's really being utilized to the best of its ability. So on a quarterly basis, advisory hosts a meeting to review our client's performance, along with performing an analysis around their adopted KPIs to ensure that we are on track. So are we meeting our goals? Are there any adjustments that need to be made? Do we have any outliers? So we hear all the time, we're managing these patients, but are we truly making a difference? And that's what we want to be able to demonstrate from a financial and a patient outcome standpoint. And I will hand it over to Jennifer to discuss the clinical transformation team.
So as Melissa mentioned, clinical transformation advisory works really closely with the population health advisors to add that clinical lens to really ensure your success and of your efforts and your care management teams, right? So we really achieve this through what we like to kind of look at as a phased approach, beginning with helping you to understand your KPIs and identify the patients who would benefit most from care management. We really help to ensure that your programs are built to meet best practice recommendations and advise you on building out the tools to really streamline your workflows, allowing you to enhance the productivity of your teams. We also really kind of focus on ensuring top of license work, right? By incorporating something Melissa mentioned, which is automation. We look at like automated task assignment to really take that manual effort away from your teams and allow the system to kind of work for you. Finally, we look at supporting you in monitoring your initiatives, kind of recommending measures for reporting and really guiding you through our reports to show you the great impact that your care managers have. And now Melissa is going to walk you through what this kind of looks like from an implementation standpoint and where advisory fits into this model.
Yes, and I will keep it very high level, but the first step we have here is system configuration. So building out your hierarchy within the Lightbeam application and attribution. So how are we tying a patient to a provider, right, to hold them responsible for that patient's care? So step 2, we have the data ingestion and validation. This is really ensuring that the data pieces that we have in the system from a financial and utilization standpoint meet the client's expectations. So this is extremely important because this is what advisory uses to evaluate performance and opportunities. So next we have advisory engagement. So this is whenever we really come in, we host a discovery session just to get to know more about your organization. And then we baseline performance and we collectively solidify your quarterly strategic goals. Next, we have the clinical transformation team with the build out of your care plans and your assessments within the application from a care management standpoint. And then the action step. This is where all of the moving pieces come together and programs are officially deployed. And lastly is the quarterly business review, where we review performance, outcomes, and make tweaks where necessary. This is also where we review those pre-post management ROI initiatives as well. All right, so now that we know a little bit more about Lightbeam, now we can hop into the population health pitfalls. So next slide, please, Jason. All right, pitfall number one is relying on delayed data sets and lacking those real-time insights. So in all aspects of healthcare management, whether it be population health, risk adjustment, quality improvement, we see a commonality in the need for timely, relevant, and high-quality patient data. So we know that claims data provides important insights, right? It shows us the utilization of the healthcare system, those associated costs. And it also gives us the ability to review historical performance. However, the pitfall of solely relying on claims data is that there is a lag in timely insights, typically a 60 to 90-day lag. It can be more depending on the plan or the contract. So another pitfall, if you will, is that it's only collected and reported on for insured patients. So how do we ensure those self-pay patients aren't falling through the cracks? And this is where those additional data sources, whether it be clinical or HIE feeds, really come into play and fill in those missing pieces. For example, your ADT data or your admission, discharge, and transfer data, right? It's critical for ensuring care coordination between different providers, reducing readmissions, and also creating a better experience for the patients. And another example here is if we're looking at claims data to follow up with patients post-discharge, we will be far past that 30-day time frame, right? And I'll hand it over to Jen to hit on the strategy pieces.
Next. So now that we know what the pitfall is and the importance behind it, right? We really want to understand how do we put in place a plan to overcome that. So ensuring you're focused on ingesting and incorporating the ADT data is really one step in gathering that picture of the needs of your patients. ADT feeds give you an avenue to prevent readmissions by really identifying an opportunity for timely outreach and management of your patients. Additionally, there is true power in combining both clinical and claims data together to provide a more holistic view into your patient's health. While claims data helps you to be reactive, kind of seeing what has previously gone on with your patients, right, and where they've been, clinical data gives you that or provides you with those much needed details, allowing you to really enhance the care for your patients by having a near real-time status of their health, ensuring that you're able to act quicker when changes and conditions are seen. As a nurse, I know that seeing my patient as a diabetic is only one piece, right, of their overall medical history. But knowing that their last A1C was 8, that they are on insulin, they're food insecure, or have not followed up with their provider recently really allows me to be more actionable in coordinating their care and their needs. Next slide, please. So how can Lightbeam help? So Lightbeam offers the ability to quickly ingest and integrate your data from a variety of sources, including providing you with a direct connection to every major EMR. This data can be accessed and actioned from a number of areas, one of which is what you see here on this slide, Lightbeam's ADT Insights dashboard. This dashboard provides you with a quick, centralized viewing of all events for your patients, enabling your care teams to act quickly on the transitional care needs of the patients. From this view, your care team members can see daily admit, discharge, and transfer notifications, as well as other key snippets of information that's really important, such as their diagnosis, the facility, and their discharge disposition. Embedded flags within the dashboard allow for a quick view of whether your patient is a high ER utilizer, is returning to the ER after being discharged, or is even a 30-day readmit. Further filtering of this dashboard really allows you then an option to customize your outreach approach, right? Supporting that existing structure you may already have in place. Next. With the addition of Lightbeam's Cohort Builder, You can increase the efficiency of your care management team through that much needed automation. This automated process really ensures the timely identification of your patients for post-discharge follow-up, knowing that often those first 72 hours after discharge are really a critical time for patients. As soon as the data becomes available, your care teams can review the event, indicating the start of their outreach, and really easily manage their tasks via an integrated transitions workflow directly from this patient panel. Additionally, on top of that, we like to add automated reminders for follow-up, ensuring that you can comply with TCM requirements, really helping you to then further facilitate that successful transition, for your patient, and help decrease the likelihood that they will end up back in the ER or being readmitted again. The patient panel also allows you to easily access all the integrated data, providing you with a quick summary of the view of your patient's clinical and claims information, really helping you to effectively manage their health. Next. So let's look at a success story here. Melissa?
Thank you. So I will briefly run through a client outcome here. So we have a multi-state health plan partner who incorporated ADT insights into their automated care management workflows with a focus on following up post-discharge. So what we saw over a 12-month period was a reduction in readmission rates by 3.2%. And this is what we really hope to see here. We want to see an improvement in care coordination, a decrease in readmission rates, and also a reduction in healthcare expenditures. So to the right, we have a quote from a client partner just driving home the point that Lightbeam not only assists with steering clients towards opportunities, but also assisting with operationalizing their workflows. So we don't just want to give you a tool and say, good luck. We truly want you to be successful within the system itself, but also within your value-based care arrangements. Next. All right, let's go ahead and hop into pitfall number 2, which is limited risk stratification capabilities. So we'll briefly go through the what is it and the big why, right? Why is this important? So risk stratification is the ability to segment patients or cohort them into distinct groups of similar complexity and care needs. And without the appropriate resources to risk stratify patient populations, what we see is organizations will take a one-size-fits-all approach where the same level of resources are deployed to every patient. And what we've seen is that this is not clinically effective. It's fairly expensive, right? And it's not a model that's feasible with limited resources, which so many organizations are experiencing right now. So it's important for organizations to understand the condition makeup and also the risk affiliated with the lives that they are responsible for managing. So risk stratification really enables providers to identify the appropriate level of care and services for distinct subgroups of patients. So from an advisory standpoint, we see a heavy emphasis on those high-risk patients from the client's end due to their significant share of medical costs. They're expensive, right? However, it's also important to take into consideration those rising risk patients, which really represent an opportunity for bending the cost curve by slowing the churn of those rising risk patients into that high-risk patient cohort. So now that we know the pitfall, let's go ahead and hop into the strategy here. So prospective and modifiable risk. So prospective risk really gives us the ability to identify patients who are most likely to benefit from specific care management programs, hopefully increase patient engagement and create targeted interventions and improve work efficiency. And whenever I say improve work efficiency, I really mean ensuring that we are deploying our resources appropriately. So one common stratification method that we've all probably utilized in our current or past life is to segment patients by high, medium, also known as rising, and low risk. So at the individual level, a patient's risk is the first step towards planning, developing, and tailoring their care plans. And at the population level, risk stratification models provide insight into that prospective cost and utilization, which really allows us to focus on proactive care versus working in a reactive state. So from an advisory standpoint, the first thing we do post-validation, as you saw in the implementation process, is evaluate the risk affiliated with our clients' patient populations and the contracts that they have loaded within the system. So from there, it's really standard practice to then identify the most prevalent and costly conditions, create cohorts based off of these conditions, review the financial and utilization rates for these cohorts, which really aids in collaborating with our clients and deploying the appropriate care management programs, along with the programs for those patients who would benefit from that remote patient monitoring. So what we really want to understand is, what does the risk pool look like? Who and what is driving that cost? And what interventions can we put in place to mitigate that risk? Next slide. All right, so here we have a very high-level example of how we would begin breaking out a population of 100,000 beneficiaries by risk and allocating the appropriate resources to the patients falling within these buckets. So Jason, if you'll click one more time, we'll take a peek at a chart on the right that demonstrates the risk breakout. So in red, we know that our high-risk patients have greater care needs. They likely have multiple complex illnesses, and they really require enrollment into a structured care management program that really provides that one-on-one support to manage their medical, social, and care coordination needs. So in orange, these are our rising risk patients. In this category, often these patients typically have several chronic conditions or risk factors who move in and out of stability. So with rising risk patients, it's important to understand their comorbidities, but also their risk factors. So obesity, smoking, blood pressure, and so many others. So with resource constraints, we look at what interventions we can deploy to reach these patients to slow that progression from the rising to the high risk cohort. And one solution we have at Lightbeam is the ability to deploy those automated clinical interventions like deviceless RPM, which Jen will go into a little bit later in the presentation, and engaging these patients without adding additional FTEs. And our green patients, these represent our low risk individuals. So for this group, we typically suggest a heavy focus on preventative healthcare. So are they getting in for their annual visits, their AWVs? We also have the ability to provide preventive screening blasts to enhance patient engagement as well. If you'll go to the next slide, please. There we go. So on top of the ability to stratify by risk, Lightbeam has additional risk stratification methodologies to ensure that we're targeting truly impactable patients. So here we see the integration of the ATI, which is Lightbeam's algorithm. And what this algorithm does is it identifies patients where the ability to impact outcomes is the greatest. So taking it one step further, we layer on SEOH data, which in turn provides a prescribed AI-generated action plan. So we're not just identifying the patients, but also advising you what interventions to put in place here. All right, and I will hand it over to Jen.
Next. Okay, so let's jump into pitfall number 3, which is the lack of whole patient health insights. So what does this mean? So really quickly, just some background. So the social determinants of health obviously are comprised of 5 key areas and represent the conditions and environment in which someone is born, lives, works, plays, receives their education, and ages. These non-clinical factors include things such as their housing status, transportation, nutrition status, and really have been shown to have a greater influence on the person's health. So why is this important besides what I just said? Failing to assess these social determinants of health really leaves you with a missed opportunity in identifying important additional risk factors that can lead to incomplete care for your patients. These risk factors are essential to understanding your patient's needs as a whole, providing appropriate care for them, and ultimately, I think what we all want to see, right, is improving and maintaining their health. Despite the importance of addressing a patient's social factors, we are really still seeing that sometimes this data is often under-collected and underreported due to a variety of factors. Stigma and shame, lack of a standardized screening tool, and even limited time by providers contribute to the lack of information being collected. While additionally, the lack of incentives and lack of clarity contribute to the limited use of Z codes by providers, impacting the overall reporting of SDOH and ultimately the ability for your organization, right, to see what is happening and your care teams to really be able to address these issues. So now that we know what this pitfall is, what can we do kind of about that as a strategy? Next. It's important that we look at a strategy focused on collection and integration of this data that gives you that more well-rounded picture of your patient population. Additionally, the SDOH information really ensures, as I mentioned before, that your care teams have that understanding they need to address barriers that really kind of prevent your patients, right, from having better health outcomes. So what are some things that we can do or that you can do, right, to really increase the collection and integration of this data? So whether it is including this as a part of your risk stratification method or incorporating assessment tools into your existing outreaches and kind of touch points that you have, our clinical transformation team really helps to provide you the direction needed to support these efforts. Additionally, you can push screenings to your patients, allowing for electronic collection of information versus having to ask sometimes those tough questions, right? That someone may not always want to answer. Provide training to your teams on who can collect this data, and maybe even more importantly, understanding how and when to capture Z codes to ensure that robust picture. So how can Lightbeam help with this? Next. Lightbeam's cohort builder and integrated prepare screening tool, kind of in the visual that you see here, right, allows for easy collection of this data, really addressing those often missed social factors, providing also an automated scoring of responses and really kind of that much needed auto capturing of Z codes. This gives you or allows you the ability to really quickly identify the needs of your population as a whole, and then really kind of aim your focus at creating initiatives to support the closure of these gaps. So one of the things I love to talk about, and I'll talk about on the next slide here, is a success story, right? So we know that we have a strategy and we have a tool in place to support that, but I love to kind of be able to highlight how this worked for others, right? So one of Lightbeam's clients was really struggling with collecting this data due to those previous factors that I touched on, shame, lack of insights to really help them start and form that trusting relationship with their patients. Because if we outreach not knowing anything, we'll often get shut down. After implementing Lightbeam's various tools, they were actually able to improve the collection of their data and really act on those recommendations to support their patients, and as a result saw a 4% reduction in their admission rate. So there's a couple quotes here that really kind of highlight how Lightbeam provides not only an easy way for you to collect that data, but also how we pull it all together from a variety of sources to really give your clinicians the ability to better understand their patients' needs prior to making that outreach. This understanding really helps to build, as I mentioned, that trusting relationship that we're after. So continuing down this path of patient engagement and forming those trusting relationships, that leads us into pitfall number 4, which is, next slide, not prioritizing patient engagement. So one of the things we're all seeing today is that many organizations in the healthcare sector are being forced to reduce their staff, right? Due to financial operational challenges. Melissa even mentioned this earlier. Additionally, on top of that, we're seeing many healthcare workers leaving the field due to stressful conditions, lack of support, and even limited staffing, right? Further contributing to that lack of resources that we have. Yet, despite those lack of resources, the needs of the patients haven't changed, and really the need to continue engaging them hasn't changed. So at Lightbeam, we've seen our clients impacted by this, by having one of our clients having to reduce their entire care management and population health teams. So why does this matter, right? So as healthcare continues to change, evolve, becomes more patient-centered, maintaining that trusting relationship with your patients is more important than ever. When patients are engaged, they are able to take or willing to take that more active role in their health and will participate in the decisions about their own care. Engaged patients often respond well to proactive outreach efforts for preventative services, will access care more appropriately, communicate concerns when they arise with their provider or care manager if they have one, practice healthy behaviors, comply with their treatment plans, and that list goes on and on. But ultimately, all of that leads to better health outcomes. Next slide. So how can we solve for this issue? With staff reductions, strategy aimed at looking for additional ways to drive patient engagement becomes the most important, right? One way to ensure this is via remote patient monitoring, or RPM tools. RPM really provides you an easy way to increase your outreach capabilities by casting that wider net with a more automated approach. Helps you to keep your patients informed by providing much needed education and engaging them, encouraging that active participation. All the while, these tools really gather that near real-time, valuable data that your clinicians need to get that full picture to really be able to prevent and detect issues early on. Choosing the right tool kind of matters when implementing this strategy because we really want to ensure ease of use for your patients, accessibility, and that it covers the needs for your population to really give you the greatest opportunity for success. Next slide. Lightbeam's deviceless RPM solution Care Signal provides you with that opportunity, really helps you to transform your approach to care management. This moves you away from that structure of those only manual outbound contacts for your high and moderate risk patients to more automated inbound insights. So you might be asking yourself right now, what does deviceless mean? How does this differ from other RPM tools? Well, many of you are likely familiar with glucose monitors, diet monitoring apps, or even other devices designed to collect that needed patient data. Okay? While a deviceless solution like Care Signal allows you to really collect that same data, not sacrificing any quality, without needing to download an app or carry an extra device. Care Signal only requires a phone, which is something that your patients likely already have. Care Signal provides a variety of programs to help you support the needs of your patient population, whether it's from heart failure to post-discharge or even health equity, further supporting what we saw previously, the need to collect that SDOH data. Additionally, as a strategy for your low-risk population or your low-risk patients, Lightbeam also offers added patient engagement capabilities through CareSignal, with the ability to push one-time messages or emails reminding your patients to get their needed screenings or providing that education, ultimately really helping you to improve your overall population health strategy. So now I want to share with you a success story from one of our client partners on this. Because I think while hearing about the tools, right, to support these pitfalls is great, that the success stories really help you to understand that potential impact. So this client is a large health system in the Midwest. Over a 5-year measurement period, and by implementing just one portion of our overall solution, they were able to validate $53 million in avoided costs and expanded their care manager's FTE to patient ratio by over 5 times. This meant that each care manager was now able to manage 800 patients as opposed to 150 prior to implementation. They were able to focus their efforts on the patients who needed it most, all the while supporting a larger portion of their population. As a result, their efforts within performance year 2022 for their ACO alone received an earned savings check of over $61 million. This success story truly shows how even one solution designed to support your patient outreach can really impact your overall approach. Now I'll hand it over to Melissa to share with you our last pitfall.
All right, thank you. Pitfall number 5 is the lack of point of care tools and automation. So we know that there are clear benefits for implementing value-based care models, such as improved patient outcomes and satisfaction, the incentive to deliver high-quality care efficiently, which overall results in better population health. However, a lack of resources really hinders the opportunity to truly accelerate adoption. So without point of care tools in the hands of providers, they really lack the insight that they need to close those critical gaps in healthcare. So it's pertinent that point of care tools house a few things, right? So provide insights into patients' needs. So really reducing those blind spots, reducing administrative work. So reducing that pre-visit time preparation prior to patient visits, and also improving satisfaction and results. And if we do this appropriately and we improve quality, this could also lead to higher CAHPS and star ratings, right? So the question really becomes, how do we utilize the data that we have available to us and get it in the hands of our providers in an automated fashion? Next slide. Okay. So the first step is really to align your organization's data within an integrated solution. So prioritizing your data sources, defining the supporting logic. And thinking back to slide 11, this is where the platform would be configured to best suit your needs during the implementation process. And as previously mentioned from Jen and I, probably a multitude of times, several data sources are recommended to really have that holistic view of the patient. So once we have those pieces in place, we can really start automating resources for practices and providers to ensure that they have transparency across their organizational initiatives, an understanding of their performance. Also, how do they compare to their peers, right? And point of care tools to really close those gaps in care. So several of our clients from a Lightbeam standpoint utilize face sheets that house the HCC and quality gaps and individual patients' cost and utilization, along with additional demographic pieces. And these can be configured to auto print based off of appointment dates, which really reduces the amount of pre-visit prep by office staff. And I'm sorry, my voice is like slowly fading, so I apologize in advance. And we also suggest configuring the application to auto-generate reporting to provide those practices and providers with insight into their performance, such as performance scorecards, right? And these will have similar information. So quality and utilization rates at different levels of the hierarchy. So let's get a quick visual of what some of these resources look like. And these were pulled out of a dummy database, so there's no PHI in here. So if you'll go to the next slide, Jason. So in the bottom right-hand corner, you can see an example of an HCC face sheet. And this is just one of the face sheets that we do have available within the Lightbeam application. So on the HCC face sheet, it outlines the not recaptured conditions for the performance year, along with any additional data points for other valid flags. And an important call out here is the risk adjustment model that's being utilized does have the ability to be configured on a per contract basis. So we know, MSSP and Medicaid and commercial and the different lines of business are likely going to have those different risk adjustment methodologies assigned to those. So we also have the V28 impact report, which provides us with a targeted approach for identifying practices and business units that will be the most impacted by the shift from V24 to V28. And this has really been critical, especially from an advisory standpoint when assisting our clients with building out those strategic plans to ensure that we have a targeted approach and a smooth transition over this phase-in period. And lastly, we have a quick view of quality performance. So on a per measure basis, we can see providers and practices, denominator, numerator, but also their performance rates. And all of these resources that I'm running through, these do have the ability to be auto-distributed to providers, practices, pub health managers, office administrators, whoever in your organization needs to get their hands on this information. Next slide, please. Okay, so we will quickly run through a success story here. So this was a client who utilized Lightbeam to operationalize their workflows, who is also highly engaged with the population health and the clinical transformation team. So the population health team identified the opportunity, ran the ROI analysis projections, and then the clinical transformation team came in and configured their care plans, their assessments, and educated their clinical staff around best practices there. So after a rolling 12-month period of this initiative, we saw a PMPM reduction of $670 within the enrolled patient population. All right, next slide. All right, so just to summarize the 5 strategies here for the pitfalls that we discussed. So real-time data insights, risk stratification, a focus on whole patient health, emphasizing patient and provider engagement, along with implementing those point-of-care tools and automating. All right, and I will hand it back over to Garrett.
Okay. All right. Well, thank you, Melissa and Jennifer. This was a definitely an in-depth presentation, a lot here, and we will be, after we're done here, you'll be able to download the slides. So no worries there. We did have some questions that came in, so in no particular order. We're going to go ahead and get to those now. If you do have a question that you'd like to add, go ahead and do that now using your control module. There's a place for questions. And if we don't get to yours for whatever reason, someone will reach out via email afterwards. So again, no particular order. First question is this. If we could only implement one of these strategies, which would you focus on to make the biggest impact?
So I'll go ahead and take this one. I think this is a great question, right? Although I'm biased and would like to say all of them. As a clinician, I really would suggest kind of focusing on your patient provider engagement, right? I think this strategy really provides you a way to kind of impact your entire population, right? So going back to our client success story, looking at one solution, really. If you can't do everything, what's something you can do to impact the most patients? So looking at one solution, you're really able to use or target efforts designed at hitting not only your high-risk patients, supporting your care management teams, but hitting those rising risk patients where you are going to see those cost changes, and then really kind of devising a strategy to keep your healthy patients healthy, right? Because if we ignore them, then they're going to slowly move as well sometimes too. So I really think that for me, this is where I would kind of suggest a focus, because you're able to impact all portions. I don't know, Melissa, you want to add anything to that?
Yeah, no, I think you covered that well.
Okay.
All right, great. Yeah, we do have a bunch of questions, so we'll get to as many as we can here. Uh, Moving on to the next, you mentioned clinical workflows. Would we have to create new workflows from scratch?
Oh, good. Well, I love this question as well, right? And I'll take this one. So, in clinical transformation advisory, our team is comprised of clinical team members, right? So, hence the name clinical transformation. So, we all have backgrounds in various areas that really support, and knowledge of care coordination, care management, and all those kind of workflow processes, right, that we're used to. So one of the things that we focus on is not only supporting our patients, but also devising standards within the platform that really kind of allow you to adopt a best practice workflow without putting in a ton of effort. I don't think anyone wants sometimes, or everyone wants, right, a platform that you have to build from scratch. It's timely, it takes a lot of resources. So we try to take some of that away from you, right? Providing you with standard care plans and assessments really focused on capturing what we believe is that needed information, right? To support the goals of your programs, to really ensure that you're kind of timely outreaching your patients and understanding their needs as a whole. So while you can customize all of that, we really like to give you a place to start. So
Great. Next question is, if you're using automated point of care tools, how do you ensure that they're being used and useful?
Yeah, that's a great question. And I'll take that one, Jen, if you don't mind. So point of care tools, one thing we talked about were face sheets, right? And from an advisory standpoint, that's always one of my primary recommendations if we do have EMR integration, so those can auto print at the point of care. So within the platform, our clients actually have access to a module that outlines the utilization and impact for these face sheets. So for example, if you're using the HCC face sheet that we have the little screenshot of there, so this module will tell you the percent of conditions captured and not recaptured, and it also informs you whether or not the face sheet was printed at the point of care. And what we hope to see here and do see across our client base, if they are utilized appropriately, is a higher recapture rate for those HCC conditions.
Wonderful. Okay, next question, moving along, is what is your one go-to report do you find most insightful and actionable?
Ooh, I'm biased because I help put a lot of these together within the platform. Uh, but it really does depend on your role and your organization's initiative. So if you don't mind, I'll throw out a scenario. So let's say we have a director of value-based care, and quarterly they go through and they evaluate their participating providers' performance. One of the most helpful reports that I would recommend would be the provider financial and utilization scorecard. So this report, it'll have all the providers and then some specific like risk analysis that are specific to their attributed patient population. There will also be cost and utilization rates across the board, along with a little bit of quality compliance. So this really gives you the ability to quickly review the performance across the enterprise and identify any outliers there. So who are some of our high performing providers, who are some of our opportunity providers is what I like to call them. So it's just a quick overarching view of your provider's performance.
Can I also step in here and kind of add a little piece if that's okay? Because I know
Please.
Melissa's biased, but I think I am as well too. So from a clinical standpoint, we have a variety of care management reporting for clinical leaders to really kind of see the effectiveness of their team, right? But I think at the end of the day, they want to be able to see that the programs they put in place sometimes are paying off. So one of the things I love to direct our clients to is our cohort trending report, which is really just a one-page visual, right? To see that the cohorts we've identified, those that you're managing, can show improvement in overall costs of your engaged population versus that population that you weren't able to engage, right? That you're seeing utilization decrease, and that it gives you the ability to kind of keep an eye on your ongoing enrollment. And really at different points in that enrollment, see when you're seeing a change, right? When you're seeing costs drive up for that population, so that you can dive into that, right? And kind of see what's happening during that time. Do you need to change your outreach efforts? Do you need to implement another strategy to kind of support some additional needs of your population? So I think this gives you one really great view, right? Into kind of showing or starting to show all of that wonderful work that your care managers are doing. So sorry for jumping in, but I just had to add
No,
that piece.
I think that's great input. And just for transparency, these are housed in the Lightbeam application, so you don't have to like pick one or the other. They're all just available through a specific module.
Very good. Very good. We're almost out of time. I have one really quick, hopefully quick answer question that came through before we close out here. And it said on the slide with Solution Risk Stratification 2.0 colon ACG, what does ACG stand for?
Yes. So ACG, it's adjusted clinical groups. So it's part of the Johns Hopkins algorithm that Lightbeam utilizes for their risk stratification. So that's a good question. And I think another call out is that we have a prospective and a concurrent model. So whichever one you choose to utilize, that's a good question.
Very good. And we do have a bunch of other good questions that came through that we have not, unfortunately, had time to answer, but we do have to wrap up. If you do have a question that, again, you're thinking of just as we're closing out here, go ahead and drop it in to the question module. Someone will get back in touch with you to answer these questions. But I wanted to thank you, Melissa. Thank you, Jennifer, for this presentation. This was very informative and well done. So really appreciate your time. As we're closing out, I'd like to encourage you all to head over to vbcexhibithall.com and check out the Lightbeam virtual exhibit booth, which is here. And you can check out some of the different resources that they have, read up on them, see what they're doing in the space. It's sort of a neat tool. And of course, you can get in touch with them there and learn more. There's also a lot of other archive resources there just about value-based care in general and anything you'd like to learn about in our archive library at vbcexhibithall.com, which is also where this recording is going to be housed. So when we're done, you're going to receive an email that's going to have a link to the recording as well as to where you can download the slides. But you can also go to the library at vbcexhibithall.com and find it there. And then finally, if you would like to get in touch with the Lightbeam team, feel free to reach out to them at info@Lightbeam Health, or feel free to reach out to me. I'm happy to facilitate an introduction as well, whatever is easiest. So thank you all again so much for coming, for spending your afternoon with us. We hope to see you on the next one. Thank you so much and have a great day.
Thank you.
Thank you.